Hi, it's Dr. Artis again, and I want to clear up some misconceptions about chiropractic care and some of the myths. And two of the biggest ones I want to discuss while we're on this video is number one size fits all. We see a lot of YouTube videos out here. We see a lot of posts on Instagram, Facebook, and chiropractors adjusting people. And people come in that have never been to a chiropractor expected to be adjusted that same way, or they don't even come in because they don't want to be adjusted like that. That's not the way that a chiropractor typically adjusts everybody. They're just posting that video to get views and likes and basically the sounds of the bones actually oscillating and actually relieving air and popping, that popping sound. And people get intrigued by that, and so they're actually curious and they think that's the way it is for everybody. That's not correct. So that one size fits all is not the right idea I want you to have about chiropractic care. So that's one of the reasons why I don't want you to sabotage your view of chiropractic by associating those videos with the way you may be treated in my office or another chiropractor's office that is not doing this type of video. So with that being said, is that the way that we assess everything is that we actually look at you or where you are. You may come in with a knee pain and another person may come in with low back pain. That doesn't necessarily mean we're going to do the same adjustment. It doesn't really make sense. So what we got to do is we got to actually assess your situation, find out where the subluxation is or the vertebrae is stuck at, and actually move that vertebrae to put it in the right position so that your body can function, so your body can heal, and you can get the benefits of chiropractic care like you deserve. Now, one of the other things too is that everybody is different. Just like everybody's fingerprints are different, everybody's body is different. So some people, they like to be adjusted hard. They like to be adjusted with a lot of pressure. Some people like to be adjusted very lightly. Some people I may use adjusting tools like an activator or arthostem on to actually move vertebrae because that's just as beneficial as using my hands. And sometimes I'll use both depending on the situation. So that's where you're going to a highly skilled, highly trained chiropractor so you can understand exactly how you should be adjusted. The second myth that I want to dispel and I want to bring to your attention is quick fixes. There's nothing that happens really that fast. Very rarely or very few cases that people come in and they're in excruciating pain and their pain is instantly gone away because we remove some of that pressure. That does happen, but that does not happen with everybody. Most of the time when you look at healing, healing is a process that takes time and it takes repetition to understand exactly if we're moving in the right direction. We keep doing those things and your body keeps getting better and better. So there's no quick fix to this thing. It's more of a long-term, long-lasting fix once you do get healed and your body heals itself. But it also lasts longer and it's not a quick thing. Like if you take an aspirin, that's just going to cover up the pain, but it's not going to actually heal you that fast. So this doesn't work like that. So I don't want you to treat chiropractic like medicine or aspirin that you come in just when you're in pain. There's so many more benefits that you're missing out to it when you treat it as a quick fix. So when you actually address those issues and you change your mindset about it, you understand that chiropractic is about your overall health and well-being. Not only if you come in about your low back pain, some people talk, oh, my back hurts. But then one of the issues that I may be looking at it, because we look at the spine from a global point of view, that pain in your low back may be coming from your neck and then your posture's off because your head is going forward like so. And so those are things that we look at and we try to address to make sure that you understand exactly why you're getting adjusted, why you need to be adjusted, and where we're going to adjust and the impact that adjustment is going to have on the rest of your body. And so we approach it very skillfully, very methodically, and very actually trained to understand exactly how each vertebrae affects the other vertebrae and how it affects the nervous system and how it affects the muscles that are around that joint and the ligaments as well. So if you understand about chiropractic, don't think that all this stuff that you're seeing on these videos actually applies to you, even though we might use some of those techniques and skills to actually get the vertebrae in the right place. But everybody's not going to be adjusted like that. Some people are literally scared to death when they come in and they actually get their first adjustment. I've had patients that literally start crying. And I don't want you to be terrified about it. The best thing that you could do is just relax. When a job of a good skilled chiropractor is to actually build trust up in the patient, to explain exactly what you're doing with the patient and let that patient know that they're in good hands and that actually we're not going to do anything to actually jeopardize or challenge their health. We're actually just trying to help them. And so once you get that in play, you tend to relax a little bit more, and that thought process understands that, what I'm doing is for the good of my body. And then you understand too that your body's going to start to heal, and you may feel different sensations and so forth. But ultimately, your body's going to heal, and you're going to be a better version of you. So I want to again clear up those misconceptions, the two biggest ones that I noticed about chiropractic care. And I want you to understand that chiropractic is good for everybody, despite the age. Like some people actually say, "Oh, I'm too old to go to a chiropractor." No, that's when you should be going to a chiropractor the most, because that's when your joints start to stiffen up. Then you got people that say, "Do you adjust babies? Why do you adjust babies?" I adjust babies for the simple fact that their vertebrae move so easy that they can actually shift the vertebrae over, and that can put pressure on certain nerves, and that can make them more colicky. It can cause digestion problems as far as constipation, diarrhea, and just by adjusting those little vertebrae so easily, they just slide like butter into place. Then actually overall functions better, and they can actually breathe better. So those are the two biggest misconceptions, and I added a third one in there about age. So chiropractic care is for everybody. My oldest patient living right now is 101 years old. My youngest patient I recently adjusted was 6 months old. So, there's anywhere in between. But the average in my office of patients that I see are anybody from 25 to like 65 is the average range. Usually more females come to doctors more than males, but I do see males in there as well. But again, chiropractic care is for everybody, and everybody can benefit in some form or fashion. So I hope that helps on your chiropractic journey and your journey to overall health and wellness. Again, this is Dr. Artis, and I'll see you later. Peace.